we all have illness at one time or another, right? And we all have to have certain kinds of prescription drugs that we take. The question is, can we afford it? It's almost like you can't afford to get sick anymore because the price of prescription drugs, it's horrendous. If you don't have at least 2 insurances and possibly even 3 insurances, you can't afford to be ill. Well, we're going to find out about the folks who are buying from Canada over the border drugs. Are they safe? Well, we've got Kyle Simon on, and he has some definite ideas about that. Stay with us. It's Pop Off. You know we do. Well, that grapevine just might surprise you. You know, health cost problems plague all of us, especially when it comes to life-saving drugs. So people turn to buying drugs wherever they can and across the border to our northern neighbor, Canada. But are we importing trouble? So we're going to check in with Kyle Simon. He's Director of Policy and Advocacy at the Center for Lawful Access and Abuse Deterrence. Kyle, nice to have you with us on the show today.
It's nice to be on. Thank you for having me.
Okay, so where do you stand on this? It's a safe country. It's not a third world nation, Canada. It's a good neighbor, etc. Is it safe to buy drugs from Canada?
Well, you know, it's safe to buy drugs from a Canada pharmacy that is in Canada, but the issue that we run into with a bill that is before the U.S. Senate right now is that although you're allowed to self-import medications under this legislation from an approved Canadian pharmacy, this includes online pharmacies, and there are about 3,400 rogue pharmacies that are actually getting medications from places like Israel and India and Costa Rica. And so these are medications that are far outside of Canada, where the FDA has no oversight over whether these medications are safe. So it becomes a public health and safety issue that we've seen pop up in multiple lawsuits and in multiple deaths throughout the United States in some of these cases.
Amazing. Okay, so we're not talking about the drugs. Well, are some of these drug manufacturers also in Canada, or are they just from all over the other countries, but you're just getting them through Canada?
Well, it's hard to say because actually there was a case where a Canadian man was actually sentenced to about 3 years in jail for selling counterfeit cancer drugs online to cancer patients. So, these medications were made up of sugar and starch. And so you have to think, how heartbreaking is it that someone is, concerned about the cost of these medications. So they turn to these, what they believe are safe Canadian pharmacies where, we can trust Canadian pharmacies if they legitimately are a Canada pharmacy. But when that's not the case, we're getting people who are sick and sicker, and, in some cases even dying because they're not getting the meds they need. So, if it's a Canadian pharmacy, that's a different story, but how do you know?
Well, the question is, too, now, if you went over the border and went to a Canadian pharmacy, would it be cheaper than what you can buy the drugs here?
It would be cheaper in some cases, and the reason is because of the vast differences in the healthcare system here between the United States and in Canada, where each of those provinces set caps. Of course, they have universal health care there, so it's a completely different structure than what we have in the United States. So that makes it pretty impossible for the U.S. government or for the cost of drugs in the United States to measure up to what they cost in Canada.
Okay, so is it possible that, say a drug that sells for, $187 in this country can actually be sold for $24 in Canada?
Sure it is. But at the same time, that requires such a profound shift in the way we have, the way we, our healthcare system is structured. And whenever the Affordable Care Act came out, there were debates about universal health care, the single-payer system, and what we arrived at were these public exchanges. So we sort of settled on, we had a compromise. And so for us to be able to do that, that's going to require a fundamental change that just doesn't appear to be in the cards.
Now, the FDA obviously decides which medications can be sold in the United States. And, I can see the possibilities there because obviously the Food and Drug Administration is going to try and make sure everything is safe for whatever we buy. However, from what I have learned, and perhaps you can clarify this, Big Pharma supports the FDA for obvious reasons. And if it's sort of like the wolf taking care of the chicken coop. It's like, if Big Pharma has influence over the FDA, then the FDA is making money from big pharma. Sure, they're going to be in bed with them and pass drugs that maybe they shouldn't, or maybe not pass drugs because they're making money from doing something else.
Well, I don't have the knowledge to speak to the relationship between the FDA and pharma, but I can tell you, the medications that the FDA is approving have been tested. It takes about 10 years for a drug to be researched, developed, and actually come to market. And so whenever they're approved by the FDA, these are safe drugs whenever they're used effectively, whenever they're used appropriately. And, the issue we don't want to put out there is, right now we're in the midst of a prescription drug abuse epidemic where more than 16,000 Americans are dying from prescription drug-related overdoses every year. So the concern for us is that if you factor in some drugs that may not even be legitimate, they may actually be made up of rat poison or road paint or whatever, not only do we have people who are overdosing, we have people who are dying because they're being poisoned because medications that are from supposed Canadian pharmacies are actually coming from the Middle East and have, like I said, these toxins in them.
Yeah, and you worry about any kind of prescription drugs, and yes, people are dying, and the FDA has approved drugs that have been extremely dangerous to people and, had to recall. So, yeah, I do trust them, but I trust them with a jaundiced eye, if you know what I mean.
Well, I think what it comes down to is, there are medications out there that not everyone can. For instance, there is a hydrocodone medication that's out on the market that is very powerful, that treats chronic pain, but it's the difference, the reason why it's out there, it has been shown to effectively treat people with pain and allow them to have a good quality of life and be productive in society. But at the same time, it doesn't include acetaminophen, which some people cannot tolerate because of liver failure or liver damage. And so there are medications out there that, they can be risky and they can be life-threatening when they're not used properly. So it's important that we implement policies like safer prescribing standards, that people are communicating with their physician so that they are appropriately and safely taking medications so that they can be safe.
It kind of bothers me just a little bit, and that's when a person is terminal. And I want to get your read on this because obviously you're in the middle of this phrase, so you know both sides of the issues. If a person is terminal and they're willing to try something, why should the FDA say, no, you can't have it? They're dying anyway. Let them try anything that they can.
Well, there is actually a bill I know that's been introduced in Congress that would permit that. And that, that's a different issue. I think what it comes down to is, personally, I'm definitely on the same side of the issue. I do worry about safety issues, but you're right. Whenever someone's terminal, that's a different story. So when it comes to alternative treatments and those kinds of things, I agree. They ought to be able to explore those in those cases.
Well, and not only that, but when they're taking the drugs, it is experimental in a lot of cases. And I realize that like you said, a drug sometimes takes 10 years to come to the market that we can use it. But someone's going to have to test things. And if someone is willing to test the doggone thing, why hold the person responsible for possibly the death of that person that it actually came up and with this experimental drug? Everything's experimental until it's out there on the market, right? Sure,
yeah, and there are, these clinical phases that they go through, they are very expensive, very timely, and they make sure that they do them as safely as possible to make sure that the people who are being tested and also the animals that are being tested are, observed, and that they're making sure that these medications are ultimately brought to market in order to treat people with, whether it's pain or anxiety or depression or whatever they might be. As far as the actual the legal side of it, I actually don't have much experience or expertise in that space.
Do you think we'll ever get to a point where the politicians in Washington will understand that a lot of people are dying because they can't really afford the drugs?
Well, I think that is an issue. I think the Affordable Care Act did a lot in terms of making people have access to medication through having insurance. So that's a positive thing that's come out of that. But there are some medications out there, like you said, and like we agree on. These medications, while they can be expensive, for instance, there's a new breakthrough medication that can cure hepatitis C in as little as 3 months. This is a disease that has been around for ages, that people have had to live with. And although the price tag on that is it's about $80,000 for for the entire treatment, it can cure a disease. And so, these pharmaceutical companies are definitely doing the research and the development to make sure that we are making huge strides and advancements in curing diseases. You see all of these stories coming out about the possibility of us being able to cure HIV. There have been major leaps and bounds made in this space, and even though these drugs are expensive, we're curing diseases. I think that's a very positive thing for public health.
Right, but that is if you can afford it. Let's be honest about it. How many people can afford $80,000 for any kind of drug, even if it is life-saving?
Yeah, I do think the upside, like I said, about the Affordable Care Act, I think about the numbers from the White House show. I think about 11 million people who didn't previously have insurance have been enrolled in the healthcare.gov exchanges. And so the people who are actually getting access through this new law, which is still very young, I think that will allow them to have, to be able to save that money. So there is cost sharing. As more people get insurance, everyone's into this pool now. So the cost of care, the cost of these treatments, ultimately, I hope we will see a decline in that. It's still a little early, but I think that's a positive development.
And yet, the politicians in Washington who do not live under the same rules and regulations that we do. They don't have to have the same insurances. They don't have to have Social Security. They're living a different life. They are not living in the real world. There's a faction there on the Republican side that wants to repeal the Affordable Care Act. Now, is it perfect? No. And I think everybody realizes it's not perfect. As you said, it's in its infancy. It's just beginning. But we've got to start someplace, because otherwise people are going to, drop dead because they can't afford it.
Right, and that goes back to the Canadian issue. We mentioned that the cost of medications there, sure, they're cheaper, but again, that has a completely different type of government. So, the one party wants to repeal the act overall, or for the most part wants to repeal it, but at the same time, if we do that, then we can't actually have people have access to these medications. So this is a step in the direction that people will have access to care. So, anything that does that is positive to me. And I think that simply turning to, allowing people to get online medication, that's not the complete answer. It sounds good. It sounds nice if you can save money, but not if you're adding things to the supply chain that can harm people and maybe even kill them.
Now, you also said that the FDA actually decides which medications can be sold in the United States, but that's not can each state do it differently if they want to?
Well, some states, the state of Maine, for instance, recently enacted a law that allowed personal importation from certain countries. They don't actually, each state cannot single-handedly say which medications are allowed. That is federal supremacy. So the FDA is responsible for that. But the state of Maine tried to do what this bill before the U.S. Senate would do, which was allow people in Maine to import these medications by themselves. The federal government just came in actually last week and overruled that and threw the law out. And so we're looking at the FDA, this is an issue of federal supremacy because it's interstate commerce. If you allow that in Maine, who's to say someone in Vermont or New Hampshire or New York or wherever wouldn't just go into Maine and do this? And so you're undermining the supply chain. You're undermining public health and safety by allowing medications to come in on a case-by-case basis. And that whenever you have those kinds of state-by-state policies, that's ultimately dangerous.
Now, is it totally against the law for someone to go to Canada to, say, a reputable pharmacy, and we're not talking about online stuff, but to a reputable pharmacy, buy something and bring it back here?
I'm not actually sure about that. I think that actually comes down to immigration or issues of actually importation at the borders. And so I know, for instance, there was a film recently that highlighted the prescription drug abuse epidemic. It was the Jennifer Aniston film Cake, where her character actually is in chronic pain. She becomes desperate and goes across the border in California over into Mexico. And when she comes back, she basically hides the medication from border patrol. And so I know that there are some issues with the legality of that. I'm not specifically sure about how it is from Canada to U.S., but I know there are some other implications that are raised, or some other issues that are raised on that.
It's really kind of frightening because, when you're in pain, you're desperate. You'll do just about anything, I would imagine.
Yeah, you're absolutely right. People who have fibromyalgia, for instance, there was a survey last year that from the Fibromyalgia Association that showed people who have that disease, and when they can't get access to their medications, which is all too often an issue now that we're implementing policies where the pendulum has basically swung back. Where we've reduced prescription drug abuse, we've made progress in reducing the number of deaths, but people are having access issues. And so the survey from Fibromyalgia Group showed that I think it was close to 40% of people, when they did get their meds, they considered suicide. It's important that people who have chronic pain have access, and that we're not putting in these heavy-handed policies that restrict access for the people who legitimately need them whenever, only 5% of people who are actually abusing them.
Absolutely. I mean, look at all the, men and women that are coming back from the wars. And,
oh, gosh.
They've got to face all this kind of stuff, all the way from, lost limbs and burns to PTSD. And, I mean, it just gets piled higher and deeper. You know what I mean, Kyle?
Yeah. And to that end, actually, last year, of course, with all the craziness going on at the VA with the backlogs of patients. I mean, these are people, like you said, they're coming back with lost limbs and post-traumatic stress and all of these different medical conditions. And, the DEA actually decided that they were going to reschedule hydrocodone products. So that's more commonly known as Vicodin, an example of those medications, a pain medication, a medication that can treat pain when appropriately used. They made them harder to get. And so what they did is previously a patient could get a 90-day supply, and now they made it to where you have to get one every 30 days. So, people who live far away from a VA facility or people who live in rural areas are having issues getting these medications. And so, the veterans are being, it's making it that much harder because obviously there's not as many VA facilities as hospitals. But even people who have, people who are homebound and can't get to the doctor as easily or can't get to the pharmacist as easily, they're having access issues. That's a big problem.
Yeah. It doesn't seem to be getting any better. And you really wonder, like I said, the gridlock when you talk about the Beltway and Capitol Hill. I don't know if changes are going to be made anytime soon. I really don't.
Well, the work that CLAD is doing, we have a comprehensive national strategy that we're working with both Congress and also at the state level, because the states have the power to regulate pharmacy and the healthcare profession, essentially, at state-by-state basis. We're making sure that we're imposing or trying to implement safer prescribing standards. We're making sure that physicians are able to and educated to appropriately treat pain, so that we're not in the position where we're doling out medications in very large supplies and making sure that we're doing it in an appropriate way. Used to be people would go in and get their wisdom teeth taken out and get a 30-day supply of pain medication. That's not proper. That's not appropriate.
No.
So we're making sure that people are getting access to medications. They're not losing access, and making sure that the gatekeeper, the doctors, the pharmacists, are giving out these medications in a way that is safe and that can treat people who need them.
And for those who didn't know what you meant by CLAD, that's the Center for Lawful Access and Abuse Deterrence, correct?
Exactly, yeah. And you can check out that strategy. It's at clad.org, CLAAD.org.
Terrific. It's just one of those things that I know it's going to go on for a long time. I mean, thank God we have life-saving medications that have changed lives and extended lives like we've never seen before. Although, we're not looking at sometimes the preventive or preventative aspect of it. And we're even seeing that this next generation is not going to live as long as their parents, which is kind of scary, when we have all this technology and we have all these new drugs, and all of a sudden, because we don't take care of ourselves initially, the drugs are not going to save our lives.
Well, I think, like I said before, I'm not necessarily the biggest touter of the Affordable Care Act, but I really do think that, like you said, with preventative medicine, that is the important part of it, making sure that, young people are seeing their doctor not only when they're, sick, they're actually doing regular checkups. And by doing that, they get that communication and that one-on-one with their physician of ways to eat healthy, making sure that they're, actually going and working out, they're getting exercise, that they're taking care of themselves so that we can prolong life. And, you see in Congress, for instance, the House Health Care Committee called Energy and Commerce, they have a 21st Century Cures initiative where they're looking at these types of medications and the development of things like this hepatitis C cure, so that we can cure diseases and people can live longer. So that, preventive medication and preventive medicine is absolutely a critical part of the picture.
Terrific. And again, they can go to CLAAD, which is CLAAD.org, to get more information about some of the things we've talked about. And I want to thank you so much for being with us, Kyle, because obviously this is just the beginning of the conversation. It's going to be going on for some time.
It really is. My pleasure to be on the show.
Absolutely. Take care now.
You too.
That's Kyle Simon, Director of Policy and Advocacy at the Center for Lawful Access and Abuse Deterrence. You don't want to abuse it, but you want to have access to it also. Looking for answers on Pop-Off? Well, that's just what we do.